We're talking to Dr. Faulkner and Ms. Phillips, both concerned with kidney disease and hypertension. Ms. Phillips, before we had our first break, we were talking about the AASK program. That is a joint program between Meharry Medical College and Vandebilt University. Let's have you to continue to give us some information in reference to that program.
Yes, as I was saying, the African American study of kidney disease and hypertension is a multi-center clinical trial that's conducted by the National Institutes of Health. And we are very privileged to be a part of that study. There are 20 centers throughout the United States, very well-known colleges and universities that are participants in the AASK study. We at Meharry Medical College are collaborators with Vandebilt University Medical Center, and between the two centers we are hoping to enroll approximately 80 patients. Vandebilt should enroll 60 patients, and Meharry should enroll 20 patients into the AASK study. We know that those numbers are not too much, because we know that, as Dr. Faulkner told you, the problem is so widespread. We know the people are there. We've had some difficulty in recruitment because people, first of all, are not aware of what the project's about. They don't know what the heartthrob of the project is. And some people are not aware that they have kidney problems because they feel like you're going to feel some things. As Dr. Faulkner said, it is called the silent killer because you don't feel necessarily anything that's going on. So what we would do is that once we've identified a hypertensive patient, and it has to be somebody who's hypertensive without diabetes, because diabetes is also a cause of kidney failure. Therefore, we have to eliminate that cause and make sure that the reason they're having the kidney failure is because of hypertension. So once we've gotten through physicians' referrals or chart reviews at local community clinics or our own clinics and so forth, we've gotten that patient identified that they are hypertensive, they do not have diabetes or other very serious chronic problems that could cause problems with their kidneys. Then we want to look at their serum creatinine, and they will not know whether or not they have any failure with their kidneys unless we monitor them by that blood test particularly. So we start with that. If they fit the parameters, say for males we're looking for the value of the creatinine to be between 1.4 and 5. For females, 1.2 to 4.5. Now, I know that doesn't mean much to you, but any person in the medical community will understand what we're talking about. So we'll find out if that patient fits those criteria. If they are perhaps borderline with that, we're looking, well, we need to look a little bit further to investigate more. We'll try to get a 24-hour urine collection to look at the creatinine in the urine to coincide with the serum creatinine, and then we'll make a better determination if they really seem to be eligible for the AASK project. One thing that I ask the patients to do when they come to Meharry is to, when I'm talking with them over the phone and to get the screening information, I tell them that I would like for them to sign the consent for us to draw their blood. I also ask them to look at a video that not only informally introduces them to Dr. Faulkner, because she's prepared the video to explain the whole project to them in a few minutes. And I found that it's very helpful because a lot of questions they may ask me are answered on that film. So they go away very, very informed by that.
Very good. You know, Dr. Faulkner, I think when we look at hypertension and kidney disease, I think we talked about it in terms of the African American situation, but exactly where does this disease fit in terms of some kind of statistical analysis across the United States? Give us that kind of information today.
Well, today there are about 60 million people with hypertension across the United States, and about 25% of those people are African American. That means that about 15 million people are African American with hypertension in the United States today. That's an alarming number, because we're only 32 million of the entire United States population. So that means a little under half of our population are hypertensive. That's a significant number. High blood pressure has been such a devastating disease for us. It can cause stroke, it can cause heart disease, it can cause kidney failure. And in the past, we have looked at all types of medications, some expensive, some not so expensive, to try to treat high blood pressure and try to decrease some of the side effects that it has on other organs in our body. Now, we have had some difficulty because a lot of people cannot take the side effects from the medications. And of course, we stopped taking the medications. This has caused problems. Subsequently, we've developed stroke, we've developed heart disease, and we've developed kidney failure. Now, only recently have we looked into the statistics of those who have been treated and found that a significant number of those who have even been treated and their level of blood pressures have been brought down to a reasonable level, 140/90, we see that those people have, for some reason, progressed on to kidney failure, even with the blood pressure
with
control.
The lower blood pressure.
That's right. So now this study, the design of this study is to look at 3 different medications. It's to look at a beta blocker, a calcium channel blocker, and an ACE inhibitor to see if one of those 3 medications is better for the kidney, in addition to controlling blood pressure. We're also looking at 2 levels of blood pressure in this study. We're looking to see if a blood pressure around 120/80 versus 140/90 is better for the patient, and matching it with those 3 drugs. Hopefully at the end of this study, we can come away saying that this particular blood pressure is more protective to the kidney, and this particular medication is more protective to the kidney, as hypertension and kidney disease relates to African Americans.
You know, Ms. Phillips, for those who might be interested in becoming a part of this study, what could they do today in terms of getting in touch with you and some of the criteria that they must meet in terms of being assisted by this program?
If anyone is hypertensive, African American between 18 and 70, they could possibly qualify. They are free to come to Meharry Medical College. They can contact me, Karen Phillips, at 327-6007, or Vandebilt University Medical Center. They may contact Nancy Rogers or Sandra Powers at 936-1179. They have a choice as to which university they'd like to come to be tested in.
And so you would encourage, now, what about the medication that's provided in this program? Do they have to pay for the medication?
No, there are no cost to the patients whatsoever. Not only do we supply the medicines that are outlined in the protocol for AASK, we also supply secondary medicines that may be needed to further control their blood pressure. They will have no cost incurred to them. Not only that, we will pay for parking, and if they have to get a cab because they can't get transportation there, we'll do everything we can to make it comfortable for them and make it as worthwhile as we can.
And so any person who might suspect that they might have some problems with hypertension can become involved with this, and practically at no cost to them be able to have access to this medication. Is that what we're saying?
Exactly. They can do nothing but benefit. Not only that, they have all their medical care, tests and so forth provided at no cost to them. They have more personalized care because we're not going to keep them waiting long and those kinds of things. So
very good. And we'll be back following this second commercial break.